Hello, my name is Dr. Adam Hyatt and I'm a surgeon at Orthopedic Associates of Lancaster. I also have specialty training in sports medicine and sports surgery, and I did a fellowship at the Rothman Institute in Philadelphia specifically to address sports-related injuries. The following is a presentation of some of the common sports-related injuries that I see in my practice. We'll go over the diagnosis, treatment, and some prevention tips to help you stay healthy in musculoskeletal health. As I said before, I'm excited to be a part of the Lancaster community here at OAL. I grew up in eastern Pennsylvania, and then from there went on to Pennsylvania State University. After graduating, I went to medical school at Thomas Jefferson University at Jefferson Medical College in Philadelphia. I did my residency training in orthopedics at Rutgers University at Robert Wood Johnson University Hospital in New Brunswick, and I did my fellowship training at the Rothman Institute at Thomas Jefferson University Hospitals, and had the opportunity to treat many athletes from high school to college age at Villanova University, at St. Joseph's University, as well as interacting and treating professional sports athletes with the Phillies, Flyers, and Eagles. I'm excited to be here at Orthopedic Associates of Lancaster to continue to deliver care to athletes of all ages. Some of the objectives today will be to discuss some common athletic injuries that sports medicine physicians and athletic trainers commonly encounter. We'll discuss treatment options that vary from rest, rehabilitation, anti-inflammatory medications, to surgical procedures. The key with preventing sports injuries is you want to take small steps to avoid some big problems. So how do people get injuries? It can occur in youth leagues, high school sports, collegiate sports, professional sports. Sometimes it depends on what position you play. Why did it happen? Well, it could be for exercise, fun, recreation, or even monetary compensation. But the treatment really depends on you. There's no holy Bible of orthopedic care. Musculoskeletal complaints are the number 2 reason that people seek medical treatment, which is a close second behind upper respiratory infections. More people than ever are involved in athletic play. This means that more people are getting overuse and traumatic injuries. And this talk could be bad for my business. So we could talk about some sports-specific injuries. Overhead or throwing athletes, such as baseball players, softball players, swimmers, volleyball players, you should think about the shoulder. And contact athletes, such as football, rugby, or lacrosse players, think about everything, from the shoulder to the hip to the knee. Think about fractures, sprains, and ligament injuries. Endurance athletes, such as soccer athletes, track, cross country, and basketball, think about overuse injuries, such as tendonitis, cartilage wear, and soreness. And other random athletes like golfers or bowling, think about upper extremity injuries, tendonitis, and wrist pain. Patient-specific sports injuries. In female athletes, think about patellofemoral disorders, disorders of the kneecap, ACL injuries, and ankle sprains. In men, think about fractures or dislocations. In kids, we think about fractures or growth plate disturbances. In middle-aged adults or weekend warriors, think about Achilles tendon ruptures, tendonitis, or patellar tendon ruptures. In the more elderly population or advanced age, think about arthritis, joint soreness, and quadriceps ruptures. It's helpful to go over some definitions so we all are speaking the same language. When your doctor talks about the bursa, he's referring to the specialized tissue, which is a potential sac in the anatomic places where friction occurs to allow smooth, non-irritating motion of one surface over another. An example would be the olecranon bursa over your elbow. When this becomes inflamed, we call it a bursitis. A tendon. This is a cord-like, primarily collagenous structure that links muscle to bone. If inflammation occurs, it's called tendonitis. Tendon degeneration. Degenerative changes are seen in a great majority of tendons, indicating that spontaneous tendon rupture is a typical clinical end-state manifestation of a degenerative process in the tissue. The role of overuse in the pathogenesis of chronic tendon injuries and disorders is really not completely understood. It's been speculated that when a tendon is overused, it becomes fatigue and loses its basal strength. We talk about a watershed area in tendons, and this is an area where blood vessels traveling from each end of the tendon don't completely reach the midpoint, and there's a relative avascularity. Mechanical effects such as abrasion can have implications in tearing of these tendons. When we talk about a ligament, we're talking about a dense connective tissue that links bone to bone. And when your doctor refers to arthroscopy, he's talking about a procedure. This is one where we use a few pinky nail-sized incisions around the joint and we're able to look inside with a camera and view it on a screen. We actually inject the joint with water to allow us to see. We then use specialized tools to either repair or remove damaged tissue from within that joint. So why do sports-related injuries happen? If viewed as a function of Newton's third law, athletic injury can be described as resulting from an equal and opposite reaction, which in turn is result in macro or micro trauma. In macro trauma, equal and opposite forces exceed the strength of a specific anatomic structure. In micro trauma, you get smaller traumas from repeated activity, and these can be cumulative. Over time, this can result in inflammation, pain, and dysfunction. Now we're going to talk about foot and ankle injuries. A sprained ankle is a very common injury. Approximately 25,000 people experience it each and every day. The ligaments of the ankle hold the ankle bones and joint in position. They protect the ankle joint from abnormal movements, especially twisting, turning, and rolling of the foot. Typically, we talk about grading these type of injuries. A grade 1 sprain is a slight stretching with some damage to the fibers of the ligaments. A grade 2 sprain is a partial tearing of the ligament. If the ankle joint is examined and moved in certain ways, abnormal looseness or laxity can occur. A grade 3 sprain is a complete tear of the ligaments. If the examiner pulls or pushes the ankle in certain movements, gross stability can occur. All ankle sprains recover in 3 phases. Phase 1 includes resting and protecting the ankle and reducing the swelling. This typically can take 1 week or even more depending on the severity. Phase 2 includes restoring range of motion, strength, and flexibility. This can take several weeks depending on the grade. Phase 3 includes gradual return to activities that do not require turning or twisting of the ankle and doing maintenance exercises. This will be followed later by being able to do activities that require sharp, sudden turns, such as cutting activities and pivoting activities, such as tennis, basketball, or football. This can take sometimes weeks or even months to recover. The most common cause of pain on the bottom of the foot is called plantar fasciitis. Approximately 2 million patients are treated for this condition every year. Plantar fasciitis occurs when the strong band of tissue that supports the arch of your foot becomes irritated and inflamed. It's designed to absorb the high stresses and strains we put in our feet, but sometimes too much pressure damages or tears that tissue. The body's natural response to the injury is inflammation, which results in heel pain and stiffness. More than 90% of patients with plantar fasciitis will improve within 10 months of starting a simple treatment regimen. This includes resting, ice, anti-inflammatories, night splints, and specific therapy exercises displayed here. The Achilles tendon is the largest tendon in the body. It connects your calf muscles to your heel bone and is used when you walk, run, or jump. Although the Achilles tendon can withstand great stresses from running and jumping, it's also very prone to inflammation or tendonitis. Problems result from repetitive stress of the tendon, and this often happens when we push our bodies to do too much. An Achilles tendon rupture is usually a catastrophic singular event, typically in the 4th or 5th decade, but can occur even earlier. We do a Thompson test where we squeeze the calf and there's a lack of plantar flexion or power. The treatment depends on the age and activity level, and the jury goes back and forth whether surgery versus immobilization is better. Your surgeon will recommend this based on your patient-specific factors. Foot and ankle injury prevention. The best advice is that if you experience foot and ankle pain during a sport, stop the activity and modify the activity until the pain subsides. Also, if you've been injured, you should go through a period of rehabilitation and training before returning to the sport to prevent recurrent injuries. Prophylactic taping and bracing, proprioceptive training programs, perineal strengthening, and stretching really does help. The most important thing is listen to your body. A sedentary lifestyle has been proposed as a main reason for poor basilar circulation for tendons and presumably is at least partly responsible for a high number of tendon problems in people with sedentary lifestyles who occasionally take part in high physical or activity sporting demands. Remember, treatment is always patient-specific and tailored towards your specific needs. Some final thoughts and resources for you to visit for musculoskeletal related injuries. Overuse injuries and tendon degeneration have been speculated to cause chronic tendon problems by disturbing the micro and macrovascular structure of the tendon, resulting in insufficiency and local blood circulation. Decreased blood flow simultaneous with an increased activity may result in a decreased oxygen capacity, impaired nutrition, and energy metabolism. And together, these factors are likely to play a role in the sequence of events leading up to a specific injury. It's true, an ounce of prevention is worth a pound of cure.